Body weight assessment is really important in our feline patients because they're actually very good at hiding weight loss, particularly a long-haired cat or a semi-long-haired cat. It can be very difficult to assess their weight as an owner in the home setting. So it's really vital that we assess body weight every time the cat goes to the veterinary practice. So if your vet doesn't remember, please remind them and keep a note yourself, because if you have a recording of your cat's healthy body weight, then you can also judge whether any weight change has occurred, and if it has occurred, also how significant that might be. And in judging significance, I quite like to look at percentage weight changes as a guideline for significance. And you can see my criteria that I've included on this slide for when I worry. And basically it tends to be that if a cat has lost more than 5% of its body weight, I am concerned. And certainly if it's lost 10%, that's very serious. And that might sound like a dramatic figure to mention to you, but if we actually think of our average cat, a 4 kilogram size cat, we're talking about very small body weight changes, just a few 100 grams. So a 4 kilo cat to lose 10% of its body weight has lost 400 grams, which is a tin of chopped tomatoes in amount, and that yet is 10% of the body weight, a huge amount. And again, if you're thinking, well, is 10% of body weight a big thing to lose? Let's make that a person. So if we have a 65 kilo person, or perhaps someone who weighs around about 10 stone, if they were to lose 10% of their body weight, they'd lose a stone or thereabouts. And if your best friend lost a stone and you knew they weren't trying to lose weight, you'd be very worried about them having something seriously wrong with them. And the same is true of our cats as well. So you don't lose weight without trying unless there's something wrong with you. Having done our physical examination, perhaps got some clues from that and from our history, we generally can't still make a diagnosis of kidney disease without doing lab tests. As I mentioned earlier on, that Persian cat with large knobbly kidneys is probably the one exception. However, we still would want to do lab tests in that cat to actually assess the severity of any renal dysfunction. And so how we assess kidney function at the moment is by collecting blood and urine samples from our patient. And it's important that both are analysed, because unfortunately the blood test for kidney function is not as specific to kidneys as we would like. In other words, there are other things that can affect our blood tests. And we look on our blood tests for something called an azotemia. And that's just a term for an increase in the blood levels of two substances, urea and or creatinine. And these are both protein breakdown substances which are normally excreted by the kidneys. And if you have a patient with kidney disease, then levels of urea and or creatinine, usually both, will increase. In addition to that, our urine sample also tells us if the kidneys aren't working properly. You can see an azotemia, for example, if your patient's dehydrated. So if you have a cat with a tummy bug, for example, they can become dehydrated, and that can increase blood urea and creatinine levels. So we need to do our urine sample as well to confirm that the kidneys are no longer able to produce that concentrated urine that we associate with good health. And we're looking there for a urine concentration at or below 1035, that 1.035, which we, for whatever reason, state as 1035. There is an association called the International Renal Interest Society, IRIS, and this is a panel of internationally respected veterinary nephrologists, so renal experts, and they've come up with some very good guidelines, and they have an excellent website which I've included at the bottom of this slide. And they suggest that we stage the severity of renal disease according to the severity of that azotemia. So in other words, according to how high blood creatinine levels are. And so I've included that here for your reference, because you may well know what your own cat's creatinine levels are and hence what stage they're in. and IRIS have published guidelines for management of cats in each of these different stages of disease. So having done our urea, creatinine, and our urine-specific gravity, we can make now a diagnosis of renal disease, but that's only the beginning, because as we mentioned at the very beginning of this talk, kidneys have a lot of complex functions. And so there are a lot of things that can go wrong in a cat that has kidney disease. So doing further laboratory tests is really helpful to identify what complications may be present, because almost always there are things that we can do to treat those complications. So firstly, haematology, looking at the red blood cell and white blood cell count, can be helpful to look for evidence of anemia, a lack of red blood cells, and dehydration. Our biochemistry, which is where we look at proteins, liver enzymes, as well as our renal values, can help to identify problems with blood salt levels, dehydration, and also evidence of other illnesses, because remember, often we're diagnosing kidney disease in older cats, and it's very common for them to have more than one problem, and that does have an impact on how we manage them. So it's important for us to find out about that. As well as doing our urine-specific gravity, it's also helpful to do other things with our urine test, such as doing a bacterial culture, because a proportion of cats, about 20 to 25% of cats with kidney disease, will suffer from a urinary tract infection at some point in the course of their disease, and that's important to treat. And also, we do know that assessment of protein levels in the urine, what's also referred to as proteinuria, is important, both from a prognostic perspective, so it gives us some information on how long our patient is likely to live, but also there are things we can do to treat proteinuria as well, so important from a treatment perspective. And lastly, in individual patients, there may be other things that we also want to look at, such as blood acidity or iron levels, for example. And the aim very much of doing all of these tests is to find things that we can change, we can correct, and we can help our patients' quality of life in the short term. But also for many of these things, treatment will actually improve their long-term survival as well. Other tests that are helpful, well, blood pressure measurement is something I've already mentioned. This top picture shows a cat actually with hypothyroidism, which I think accounts for its slightly anxious expression, having its blood pressure checked. This is a very routine test now that we can do in our clinics and assess our blood pressure. And the bottom picture shows some of my colleagues looking at a cat's eyes for evidence of high blood pressure, because we can see evidence of bleeding in the eye, detachment of the retina, for example. So how do we treat kidney disease? Well, I think the most important things to start off with are making sure that as far as possible we have as much information as we can, because if we know all of the different complications we're dealing with, we're in a much better position to provide the best level of treatment. And I very much encourage you to really speak to your vet about all of your concerns. Find someone in the practice that you can relate to and develop a good working relationship with them, whether that's just a vet or a vet and a nurse, or perhaps just a nurse. And because the best outcome is only going to be achieved by, firstly, this attention to detail, but secondly, having a really good team approach. So remembering what our normal kidneys do, which was right back at the beginning of this lecture, if we then think about the patient that has kidney disease, we have a lot of consequences to fight. So our patients are vulnerable to dehydration, they're vulnerable to problems with their blood salt levels, their blood acidity level, their blood pressure, anemia, all sorts of things that we need to bear in mind. And again, this is just another advert really for doing as thorough an assessment as we possibly can, so that we can provide the best individualized treatment for our patient. So it is possible, having said that all these complications exist, it is possible for the overwhelming majority of cats to provide really excellent quality of life for really very long time now. I mean, my best really severe renal patient, a cat in stage 4 renal disease, unfortunately, sadly, recently died. But this cat actually had done extremely well for about 8 years with stage 4, the most severe renal disease that exists. So really, there's a lot of good news when it comes to managing this condition. And what I'll do just to finish off with is go through each of these little sections one by one to talk about the key points relating to each of these treatments. So firstly, diet. Now, any of you listening who currently have a cat with kidney disease will probably know that feeding a renal prescription diet is the ideal, because this is something that's very well established now, and it is the single most proven effective treatment for cats with kidney disease. And the thing to remember is that if you can encourage your cat to feed a renal diet, then on average it's likely to live 2 to 3 times longer than if it was fed a normal cat food. That's a huge, huge difference in life expectancy, particularly thinking of a cat's age, 2 to 3 times longer. We're talking about many years longer. And it's especially proven for cats in the more severe kidney disease, so stage 3 and 4 kidney disease. Renal diets have a lot of modifications, and from my perspective, it's like having multiple different medicines cunningly disguised in a cat food, which you can offer to your pets. So it's not a single treatment, it's multiple treatments. These diets are often very high in calories, which help cats with poor appetites to maintain their body weight. But the key other characteristics are that they have limited amounts of protein, because this is something that cats with kidney problems are struggling to excrete. They also have limited amounts of phosphate, where the same also goes. So cats with kidney disease are vulnerable to retaining phosphate. They help prevent acidosis, where the blood becomes more acidic than it should be. And they have extra things added which cats with kidney disease are vulnerable to losing in their urine, such as B vitamins and potassium. So lots of modifications, and overwhelmingly the best outcome if your cat can be persuaded to eat a renal prescription diet.